everyone, my name's Dr. Amna Husain, board certified pediatrician, board certified lactation consultant, and mom. Today we're going to be talking about a topic that can be very frustrating, very anxiety provoking, and definitely very cumbersome for lactating parents, and that is triple feeds. So let's first talk about what is triple feeding. I feel like there's a lot of stigma, and not necessarily stigma that's negative, but stigma that's more anxiety inducing associated with triple feeds. And essentially what it is nursing the baby, then pumping and supplementing with the pumped milk thereafter the feed. And that is, and in fact, what is the triple part? So those are the 3 steps of it. And we'll definitely break it down and talk about each step in more detail in this video. But let's talk about when we recommend triple feed. So typically, and I say this as a pediatrician and as a lactation consultant, we don't across the board recommend triple feeds. And in fact, this is usually a short-term solution, not something we want parents to keep up long-term, because it's really difficult. It's really not feasible to be able to keep up this kind of schedule with a newborn's just demands of sleep and nursing and being able to do the rest of your day-to-day life and even take care of yourself as a parent. So typically we recommend triple feeds in certain cases. If you have a child who is sleepy at the breast, a child who is jaundiced and beyond perhaps the expected level of jaundice. This is jaundice that the pediatrician might be concerned about. Also, weight loss. Now, in the past, I've talked about newborn weight loss and what is expected, but perhaps this baby might be approaching the beyond what we'd like to see threshold of weight loss in the newborn days of life. Now, it's important to note that a lot of those challenges that I just mentioned, so the excessive weight loss, the jaundice, and the sleepiness, we often see with late preterm infants. And late preterm infants include those infants between 34 and 37 weeks gestational age when they're born. So that's going to be really the 4th sort of catch-all moment where you'll find that you're often introducing or considering or playing around with the idea of advising triple feeds for these families. Another example would be an ineffective suck-swallow pattern. Now you can see this, yes, in a late preterm infant. You can see this in a term infant. You can also see these in infants who may have a genetic syndrome or may anatomically have some reason for a smaller jaw and then have an ineffective suck-swallow pattern, a larger tongue. There's many different reasons out there that we might see this. And then lastly, if you have an infant who has difficulty latching. Now, I actually fell into this part of the reason for triple feeds, and that was with my oldest. She was a full-term infant, but for whatever reason, we had difficulty with latching. And we tried a number of different measures, initially a nipple shield, and, I sometimes regret introducing that. This was before I became a lactation consultant, but a lot of this was new to me. And as a first-time parent, I was pretty overwhelmed and trying to really revisit taking away the nipple shield, latching again, it was not successful. So in those first few days, we did do triple feeds, especially because I was a first-time parent and milk was slow to come in. We again had an infant who we were concerned about jaundice, we were concerned about weight loss, and thankfully we were able to keep her out of the hospital for phototherapy needs, not being admitted for excessive weight loss. But triple feeds was something that I have personally gone through and experienced, and I understand how difficult it can be. So let's launch into what exactly is triple feeds. First step of triple feeding is nursing the baby. Now you're gonna try to nurse the baby at the breast. I've had lots of videos on this in the past that we talk about how to get the perfect latch, and we talk about what are the things that you can do to set yourself up for success with nursing, things that would not be recommended. So when it comes to nursing baby, making sure the baby is latched on appropriately, step 1, and you're gonna try to nurse the baby generally 8 to 12 times in a day. Okay, so every 2 or 3 hours means 8 to 12 times in a day. Now, ideally, you're gonna want to put baby on the breast and at least try to get a good 10-minute feed. Of course, I don't want to cut baby off at the breast, right? We don't want to like limit the time that they're on the breast. But if you have an infant, that goes back to that first list. If you remember, sleepiness, excessive sleepiness especially, and jaundice can be associated with excessive sleepiness, then you're really struggling to keep that baby awake. And it's really counterproductive and futile to spend an hour with the baby on a breast that you're constantly having to wake up, wake up, wake up, wake up. So instead, put baby on the breast at least 8 to 12 times during the day or every 2 to 3 hours to ensure adequate empties. And then when they're on the breast, each time they're on, at least 10 minutes where they're feeding at the breast. And if they're falling asleep thereafter that and it's difficult to wake them up, then call it quits. And that's the end of really trying to nurse them at the breast. That's really the end of step 1. So let's move on to step 2. Step 2 of triple feeding is pumping. Now, when it comes to pumping, you're going to want to pump right after feeding the baby. Now, generally, you're not going to feed the baby the milk that you're pumping at this session. Instead, you're going to use pumped milk from a prior session. But it's important for the breast to get their full empty, so you're going to try to pump for at least 15 to 20 minutes. Now, a double electric pump versus a hand pump is a little bit easier, especially because you're not trying to waste time and pump manually for 15 to 20 minutes on each breast after you've nursed a baby. So definitely recommend a double electric pump. Definitely recommend for at least 15 to 20 minutes. And when it comes to using stored milk or storing breast milk, please remember my rule of 4s. I have filmed before on what breast milk storage guidelines are. But when it comes to freshly pumped milk, remember that milk can sit out safely for up to 4 hours at room temperature. So you can actually use this pumped milk at perhaps the next feeding. Because remember, you're feeding baby every 2 to 3 hours. You should fall within that window. So let's move on. Step 3, and that's supplementing. So that's the last step of triple feeding. Now, when it comes to supplementing, you're going to supplement with the milk that was pumped at a prior feed. This way, that milk is readily available. You can have it warming, you can present it cool, you could present it at room temperature, however you choose to present it to the baby. But this is where you now supplement what the baby's nursing feed was. And you're going to supplement with whatever amount perhaps your pediatrician has set. Depending on the baby's age, that could be anywhere from 5 to 10 to 15 mLs up to 1 ounce or 30 mLs. Now, generally, when you're supplementing, a lot of people talk about a bottle, right? And we've definitely discussed paste bottle feeding in the past. I'll link that video right here. I definitely recommend paste bottle feeding when feeding a nursing child, but there are other modalities as well that you can introduce pumped milk. And again, this is something to consider, especially if you have a child who's got excessive sleepiness and isn't really latching onto a bottle, or they're not having an effective suck pattern, or they're not able to effectively latch. So in that case, you might consider finger feeding, right? You might consider syringe feeding, you might consider cup feeding, or even a supplemental nursing system. And with all of these modalities, again, they're not long-term solutions, but instead short-term solutions. Because remember, at this point, a feed from nursing to pumping to then giving the bottle should be somewhere between 45 minutes to an hour. Now, there's different situations where you could probably, if you have the right kind of pump, for example, something wearable like the Willow, the LV pump, and there's more on the market now, you could probably paste bottle feed the baby your supplemental feed and do step 2 and 3 at the same time. Or if there's a support partner there, you can take care of step 2 of pumping and then have them take care of step 3. That way you're kind of tag teaming this. But the important thing to understand is usually we don't recommend triple feeds longer than, I would say, 2 to 3 days. I really try not to exceed a week because 1, it's very difficult to upkeep. But 2, remember after 2 or 3 days, your body's going to respond and produce a lot more milk because not only have you had somebody nursing, you've also had the pump stimulating as well. So you have 2 different modalities that are now increasing your milk supply, and your body should respond to that appropriately. We don't want to necessarily get into an oversupply situation, which is very common with triple feeds. But at this point, your baby should have put on a little bit more weight, because we're kind of getting crafty here with making sure that they're not too sleepy or getting around the jaundice or the ineffective suck pattern. And they should be a little bit more energetic, and they should be a little bit more willing to nurse at the breast and nurse longer and nurse more effectively at the breast. This is not the case in every situation. Of course, if there's an ineffective suck swallow pattern and that's due to something anatomic or genetic, then of course that's not going to be treated in 48 to 72 hours. But generally, this is not a solution that we keep for a long-term period of time. Now, one important caveat I do want to mention is a lot of mothers, when they're doing triple feeds, they may not have enough at the third step to supplement all with pumped breast milk. And that is okay to use your pumped breast milk first and then formula to make up the difference for whatever you're trying to get to or whatever's been set as your pediatrician as the supplement amount. And that's okay. That's totally fine. Usually we recommend breastfeeding first, especially the parents who are dedicated to triple feeds. They're usually trying to do so because they want to make breastfeeding really work for them, both the baby and the lactating parent. So I hope that answered your guys' questions on triple feeds. That was a lot of information. I know that when I went through this for the first time, it was exhausting, and I did not have a wearable pump, and I did feel like the world was crashing down, and I didn't know how to get through each feed. I felt like I was quite literally either attached to a baby or a pump at all times. And I do definitely think that there are smarter ways to do this, but it is so tough. So I completely give it up to parents who are doing triple feeding for longer periods of time. Honestly, sometimes even parents of multiples, twins, triplets, they are often doing triple feeding as well to help stimulate their supply and have enough to feed their infants. If you guys have questions below, please make sure you ask them. If this video was helpful, give it a thumbs up. Definitely save it and share it with a parent who might be experiencing questions or going through triple feeding, and hopefully it's helpful for them. And if you've gone through it yourself, leave a comment below. I'd love to know your experience with it. We'll see you guys next week. Bye.